Chemotherapy is a treatment that raises a lot of questions and concerns for people who are about to receive it. We hope that this video will help to answer many of those questions and minimize your concerns. Chemotherapy can cure some cancers. Chemotherapy can reduce the risk of recurrence of many cancers after surgery. And even if it can't cure the cancer, chemotherapy often can prolong life.
Kind of when I was going through chemotherapy, I was still able to go to work. I was still able to get out, exercise, walk around. I was able to travel. I was able to, visit people. You don't want to get the impression of chemo that you're going to be alone all the time, sitting in a room by yourself. You're still going to have daily activities, and you're still going to have your life to live while you're going through it.
It's scary, but it's really not as tough as you expect it's going to be. The drugs they give you to help you get through it is just, you just sail right through it. It's amazing how fast the time goes when you're going through it. It really does go fast.
Types of cancer treatment. Chemotherapy can be used alone for cancer treatment, but is also given with other treatments, including surgery, radiation, biological therapy, and endocrine therapy. As cancer research advances, more and more options for treatment are available. Clinical research trials make this possible, and you may be eligible to take part in a research study. If you are interested in a research study, please let your oncologist know. Surgery. Surgery can be an option for some people with cancer. It can be performed before or after chemotherapy or other treatments. Radiation. Radiation is a cancer treatment that uses high-energy X-rays to kill cancer cells. It is given to a specific area of the body, usually with repeated treatments. Biological therapy. This is a treatment with substances that boost the body's own immune system to fight cancer. Endocrine therapy. These medications block the effect of hormones to control certain cancers. What is chemotherapy? Chemotherapy includes medications that destroy cancer cells by stopping them from growing or multiplying. Different chemotherapy drugs work on different cancers. Your oncologist will choose the chemotherapy best known to control or destroy your cancer. Unfortunately, chemo can affect healthy cells along with the cancer cells. Thus, side effects occur. This video will further explain these side effects and teach you how to best manage them. How is chemotherapy given? Most chemotherapy drugs are given through an IV, intravenously. Chemotherapy can also be given many other ways, including by mouth, as an injection or shot, and even on the skin. For IV chemotherapy, your chemo nurse may place an IV in your hand or arm, or you may have a longer-term IV access, such as a portacath or PICC line. The chemotherapy runs through these IVs, and the infusion may take anywhere from a few minutes to a few hours. Temporary IVs may be taken out at the end of the treatment. Chemotherapy can be given several different ways. For example, you may get chemo 5 days in a row every 3 weeks, or 1 day a week, or 1 day every 3 weeks. What about your other medications? Tell your healthcare team all of the medications that you take, including vitamins and supplements. Usually, you will keep taking your regular medications. But some of the herbal medications can conflict with chemotherapy, and you may be asked to stop or hold these medications around the chemo treatment.
One of the big things, if I would have a side effect, my wife would always be telling me, you need to call the clinic right away, call the doctors right away, call the nurses right away. You have to let them know. They need to know what your problems are to help you with them. And you're not going to always want to do that, but you have to realize that you're sick, you need to get taken care of, and you need to get the help that you need to get better.
Side effects of chemotherapy. Possible side effects include decreased immune system, nausea and vomiting, fatigue, mouth sores, hair loss, dry skin and sun sensitivity, fertility effects, lack of appetite, diarrhea, and constipation. Throughout this video, you will hear us mention your healthcare team. This team includes your oncologist, your nurse practitioner or physician's assistant, your nurses, dietitians, and social workers. Your healthcare team will help you throughout your chemotherapy experience. We may consult with other specialties to help with your care.
They told me just to listen to my body, and when I was ready to go to bed, go to bed. Don't force yourself. Take it easy, especially like when you're bathing. The simplest things in life will just wipe you out. Making the bed, I remember, was just such a hard job. I would be so winded, and then going up and down the stairs, and they just told me to listen and take care of myself and get plenty of rest, lay around, baby myself, and that's basically what I did.